Good afternoon, everybody. We'll go ahead and get started. I'm Rhett Melton, the CEO here at Partners, and I'd like to say welcome to Partners Regional Office here in Hickory. Special welcome, Governor, to you, and thank you for taking time to be here and join the community conversation today. I know there's other elected officials here in the room with us, so if you don't mind, if those that are in elected offices, if you would stand up and just introduce yourself to the room so that we know who you are, and we're glad to have you with us. So if we want to start, ma'am, you want to start here?
I'd be glad to. My name is Sherry Butler. I'm a Catawba County Commissioner.
I'm Dan Hunsucker, also a Catawba County Commissioner.
Ron Abernathy, Catawba County Board of Education.
Andrew Tanner, Bourbon County Commissioner.
Barbara Duff Beatty, Catawba County Commissioner. Anita McCall, Lincoln County Commissioner and Vice Chair.
Great. So I'd like those of us in the room to give y'all, I'm sorry, Sheriff.
Chief Sheriff Collins.
That's right.
I'm Alan, I'm from Gaston County.
I was going to say, did you get lost there?
Took me 4 hours, but I made it.
Scott, and the
Hi, sorry I'm late. Scott Riley, I'm an attorney in Newton and the district attorney-elect beginning
Great.
January. Thank you.
Let's give those guys a round of applause for the service they give. Yeah, when you look around the room and you see all the people that are here, and again, thank you all for being here, the diverse organizations that are represented here really speaks to us, I think, about the topic that we're here to talk about today from a couple of standpoints. One is it affects all of us, whether you're from law enforcement or healthcare or the government's services sector or whatever organization that you're with. This opioid epidemic is a crisis for everybody in this room and everybody in our counties, our state, and across the country. So I think the interest in the diverse group here is testament to that. And I think the other thing, when I look at the group of people in the room and know that Partners is working with everybody here on different levels around this topic, is we know that the solution is going to come from a diverse group of people. It's going to take all of us working together, sharing resources, sharing information, sharing ideas and sticking with it together in order to solve this problem. So it really is exciting to see so many people here today. One of the things that we often talk about when we talk about the opioid epidemic is it didn't start last night, and we're not going to solve it tomorrow. But but with all of us, I think the commitment that we all have to stopping this debilitating crisis that we have, not just for the people that are affected and the lives that it's destroying every day, but again, what it does to our community. What it does to the economic growth of our communities and our state is significant. So it is going to be a long journey. And again, with all the talent that's here and across the state, we can win and we will win. And it's exciting. I want to recognize another team member from Partners. So Barbara Hallisey is on the front row. Barbara is the Assistant Clinical Services Director for Partners. She's the one that was coordinating with the governor's office to make today happen. And she's also, you're going to see her up here facilitating and trying to moderate and keep things going. So Barbara, thanks for all the work that you've done. So without delaying any further, I'd like to welcome the panel here and thank you for being here. And we want to turn the time over to you. And again, first and foremost, I want to say welcome and thank you. And I'd like to introduce to the group the Honorable Governor Roy Cooper. Thank you.
Well, thank you, Rhett, and thank you, fellow panel members. I look forward to this discussion. Sheriff Cloninger, thank you for your longtime friendship. I'm glad we've got local officials and the new DA and others who are fighting this issue on a daily basis. We are in a crisis. 12,000 deaths since 1999. When you have that conversation with a mom who has lost a child to an overdose, you feel the tragedy. When you talk to families who are working with a family member that is in and out of treatment, who is trying to get it together and continues to relapse and continues to miss work and run up medical expenses, when you see families run into economic crisis because of the inability to help a family member, when you talk to a business owner who's trying to get people to work or having their own workforce affected by opioid use. We know that our economy is being affected by this, our health, and we know that people's lives, too many have been lost, and too many families are struggling. We know that particularly in North Carolina and in this area of the state, we are facing a very difficult situation. I want you to know that as governor, I'm taking this issue seriously. I've issued an executive order regarding the being able to draw down $25 million in federal funds and directing our Department of Health and Human Services to make those applications for those grants. We've got Cody here today to talk about that plan. I also served on the President's Opioid Task Force. We know that all of us have got to pull together, local, state, federal. It's got to be bipartisan. It's got to be members of community, because we know this is an issue we all have to tackle. In the law enforcement arena, we're seeing them having often the initial point of entry of a person who has this kind of problem in substance use disorder. And it's taking a lot of time and effort from law enforcement. And many of them know that we cannot arrest our way out of this problem, that there are people who present in the law enforcement arena who ought to be getting treatment. And there are a number of things that we can do to extend treatment to people who need it. Not only federal and state grants, but pushing private insurers to make sure that they provide coverage for evidence-based treatment that people are getting. And what we could do is by expanding Medicaid in North Carolina and pulling down all of those federal dollars that we've already paid to Washington and ensure hundreds of thousands of working North Carolinians, that would also increase the coverage for substance use disorder. There are a lot of things that we need to do, but I know that it's not going to take any one person. It's going to take entire communities, and it's going to take our state pulling together to get this done, in our country for that matter. We have to continue to fight this fentanyl, synthetic fentanyl that's continuing to be mixed with heroin, that's really seen an increase in the number of deaths. The thing about it is that all of this has been predictable. I mean, we've known that this is coming. We have to continue with the action that we've taken. We've significantly reduced access to prescription drugs, but we know that that's having the effect of pushing people to illegal drugs on the street that are often just as deadly and sometimes deadlier. So I'm here today not only to help with solutions, but also to learn. We've been meeting all over the state with people regarding this issue. And we have to take action. We have to continue what we're doing, but we have to do more. So, Rhett, thank you to you and partners for agreeing to host us today. And I look forward to this discussion. Thank you.
For next, I guess it's my pleasure to introduce Cody Kinsley. He is the DHHS Deputy Secretary of Behavioral Health and Intellectual and Developmental Disabilities. Thank you for coming today.
Great. It's a real pleasure to be here, and I want to thank again partners for their partnership, which is great. That's your name. So I think a few things that I want to just lay out, which is first and foremost, the governor pointed to his real leadership and direction around how we're coordinating to address opioid use disorders in the state. And what's been amazing, and I've having worked in various branches of government across the country, I've not seen such a response that I'm seeing here, which is every single apparatus of state government coming together and recognizing every lever that can be pulled and trying to do that in the most efficient and leveraged and synchronized way possible. So I want to talk briefly about some of those projects and programs that we're working on, some that have been well underway, and then some of the work that we're working through. And several of the folks that are here today will be able to talk about the real on-the-ground work that they've been doing there and that's making the difference, hopefully, in people's lives, and still more work to do. But so to the governor's point about the state opioid response grant that the federal government has put out, this is the second of two. I think folks will know that there was a federal grant called CURES, or STR, that was referred to. That was $15.5 million over 2 years. We pumped the majority of that into treatment. We had expected those treatment dollars to reach about 1,600 people. The course of treatment is roughly $625 per person per month. For those that are in opioid use treatment, it's a long-term sustaining thing. It's not you don't come out of medical assisted treatment or other treatment models quickly. It takes time, as I think you all know. And so it's a very expensive treatment regimen. We're really happy, and this is, I think, credit to partners and our other LME MCO partners across the state. We leveraged that funding, and we reached about 5,700 people in the first year of that grant funding. So now we're in the second year of that. We're still focusing on the medically assisted treatment models, kind of a fully integrated approach. And as the governor mentioned, we have applied for another round of federal funding that will come in October. In total, that'll be another 2-year round. It'll be $22.7 million per year. So we're looking at about $45 million total. That is an increase over what we've had. And so we're hoping that that will continue to scale beyond that 5,700 and go further in sustaining that treatment over time. But as you all heard, the numbers, and this is still a drop in the bucket. And so it remains told that these populations are folks that don't have access to insurance frequently, and not having the ability to cover that care is a costly endeavor. And I think we'll hear about that today through members of the panel. So some of the specific programs I want to lay out that we're working on with this federal funding beyond just the direct service treatment dollars is a few very targeted pilots to really understand how this is playing out on the ground. So 2 specific populations. One is our DSS-involved families. So many of you, folks that have come from the DSS world, you may know that parents who may have health insurance by way of their job or by way of Medicaid or some other source, when their family gets involved in DSS, there's an issue when their substance use disorder is coming out, and it's the possibility of that family losing their child. When they lose their child, if they've had Medicaid coverage by practice of having that child, when they lose their child, they lose their Medicaid coverage right now. And so therefore they've lost their insurance that's going to pay for their treatment, that's going to try to find a path back to recovery. So we're working hard at the department to use a lot of different sources of funds and federal grant funding to try to blend together some opportunities to sustain that coverage, right? If the goal for the department is to reunify that family, then we need to give that family a fighting chance and give them access to treatment dollars. And so that's been a huge focus for us and will continue to be in this new grant. The second big policy or public area that we're looking at is with reentry and justice involved populations. So I think many of you may have seen a recent study that came out focused on North Carolina individuals reentering society after finishing their terms of service in jail or in prison, and many of them who have lapsed substance use disorders restart use and they die. And it becomes a death sentence. And so I'm really proud that we've struck up a partnership with the Department of Public Safety, made possible, again, through the focus of the government and the governor's office. And we're looking at, they're standing up 2 Vivitrol clinics within their reentry facilities so that individuals, as they're getting ready to go back into the community, they've had reentry or they've had Vivitrol, they're leaving with naloxone in hand, and they have an appointment for treatment in the community when they get there so that they have a fighting chance as they re-enter society, and we try to curb back the deaths that way. We will continue to pump about $15.5 million or more from this federal funding every year we can get it. But again, it's year over year, and I think that's a big part of the problem. When I travel around the state talking with folks, they're like, well, what happens in the next year, year 5? And that's a big question mark. And I think what we're seeing, and I think what our MCO partners speak to often is, many of you are business owners or business operators, you work at businesses, like it's hard to stand up a new business without the promise of long-term sustained funding, right? And so a lot of these treatment facilities, a lot of these service providers are businesses, just like any business on Main Street. And for them to make a difference, they need to have that confidence that we're going to be there. And so the department's trying to be very strategic about how we sustain that and how we try to continue to provide that care. But again, it goes back to that question of medical coverage and medical insurance. I want to also just echo one more thing and give other folks a chance to chime in too, which is just the reverberating effect I think this is having in economies as employers try to understand how to deal with individuals not able to pass a drug test, right? And for me, from a treatment perspective, I'm incredibly interested in that moment, right? When an individual doesn't pass a drug test and they have a choice to potentially lose their job or potentially maybe look at going into treatment, what does that risk look like? How do we work with our service providers to try to manage that handoff? And so that's another area I think we're trying to lean into, which is, what's that truth moment I think that folks in active substance use disorder are having to deal with, and then how do we try to capitalize on that moment and get people into treatment and into sustainable care? So anyways, in sum, there's a lot of activities underway, and it is really taking a huge community effort and a lot of different service providers. And I think later you'll hear particular from a member of the panel who's a peer support specialist, which I just can't say enough. The department's about to finish up a definition around peer support. We're trying to figure out a way to define this as a service array and pay for it as a service providing entity within our healthcare continuum. I mean, these are the folks that are making up the difference in community support, right? Like, people who have active substance use disorders who also have a lot of rotten teeth in their mouth. It's really hard to focus on recovery when you have constant toothaches, right? I couldn't focus on anything, right? Peer support specialists help people navigate the healthcare continuum to get that kind of care, to get that kind of service, so that we're really looking at whole person integrated approaches to this issue. Because it's not just getting to your MAT appointment. It's not just getting to your clinical care, your detox appointment, or what's going on. It's really about the whole health spectrum of this individual's life. And that's really what we're focusing on. We're trying to wrap all these services around people. So anyways, thank you for the privilege of being here, and looking forward to talking more with folks.
Governor Cooper, you've been a tremendous advocate for opioid epidemic, serving on the President's Commission and locally across the state, and really driving that 5-year North Carolina plan and involving DHHS and all the other agencies, law enforcement, hospital, healthcare systems to address this horrible epidemic that's ravaging. I wish you were here for better reasons, but Hickory and Catawba County definitely have experienced this crisis on a very personal level. I hate being too short for these mics. I'm very proud to work for partners. Back in 2015, we really identified that this was a crisis. We had to start focusing on what we could do. We're one of 7 public entities that manage behavioral health for Medicaid and the uninsured population. And I think if this crisis had happened 15 years ago, everyone would have just been pointing at behavioral health and saying, this is your problem, fix it. One of the things that has been incredibly rewarding over the last few years is that the community is really recognizing this is all of our problems. This is impacting our loved ones, our ability to grow business in the community, our demands from county government to keep building bigger and bigger jails. So we've actually seen communities pull together and work in coalitions. And today is going to be talking about the solutions, what's working. And one of the things that Catawba has going on is Project Lazarus. And that is a model that started in Wilkes County, close by here, has become a national model of various community agencies pulling together and addressing harm reduction, education of providers, as well as community members to stem the tide of the opioid epidemic. Partners, one of the things that we did back in 2016, we had our first health summit, and we decided to focus on opioids. So we had an opioid summit in Iredell, in Statesville, and we completely filled up that convention center. So the next year we did it, we moved it to Hickory, to the Hickory Convention Center, because it's a good bit bigger. But we now have had our third one this past April, and we get a full crowd coming in to talk. We've brought in national experts, but we have also identified we have lots of local experts. One of the things partners did in the last year is hire Dr. Elizabeth Stanton, Beth Stanton, as our chief medical officer. She is a nationally known expert on addictions and very passionate about addressing opioid use disorder through a medicated assisted recovery process. We know that medications are not the answer by themselves, but they're an important component. We also were able to bring in Dr. Thomas McClellan, who is the chief scientific editor of the first ever Surgeon General's report on addiction, facing addiction in America. And he was able to work with our team, present at our conferences, and evaluate some of our initial innovations to try to address this crisis. One of the first programs that we did was out of Sheriff Cloninger's area, the drug diversion and treatment therapeutic living. When we manage Medicaid well, we're able to reinvest those savings into innovation. Partners over 5 years has committed more than $2 million of Medicaid savings that we're reinvesting into addressing the opioid epidemic. And so we invested over $266,000 to specifically target people on their second offense of being arrested, and how we then could work with people who may end up spending a large part of their life in and out of jail on drug-related charges into an intensive treatment program. And so we were able to serve 23 individuals in the first year. 22 of those completed the program and graduated. A year later, one of those graduates has also become a certified peer support specialist in the network. So we're seeing progress, we're seeing solutions. I would like to start with Dr. Corey Richardson and have him talk a little bit about Project Lazarus and how that is working in Catawba County.
Thank you, Barbara. Thank you, Governor, for coming today. I want to thank you specifically for your signing into law STOP Act. The opioid action plan, which included recovery-oriented systems, is part of that action plan going forward to address the crisis. And I want to thank you for securing money for the state. As you mentioned earlier, 12,000 North Carolinians have died since the epidemic had started, and that's 350,000 in the country. The CDC, as you probably know, released some statistics recently, last week I think it was, for 2017. Again, a dramatic increase in deaths, 72,000 in the country, with over 20% increase in North Carolina. And so I think that part of that is going to be related to funding. I think we do know that what works, and I actually created a slide for you that's in your folder today and gave it to the audience. An integrated care model. Unfortunately, you've had to become an expert on this as well. You haven't done the work that you're doing without becoming an expert. This is a complicated disease, and so it's going to take all the different inputs that you can possibly imagine to get the treatment outcomes that you want. So we're going to need the biological aspects of it, like medication-assisted treatment appropriately. We're going to need evidence-based counseling that ties to that medication, and it should be evidence-based tying into recovery so that when treatment ends, there's long-term recovery still. And as mentioned, there are a lot of social determinants. Unfortunately, a lot of people who have this disease are in the lower socioeconomic strata, and the disease itself pushes people into that. The Deputy Secretary mentioned recently about not enough Medicaid dollars. And so the uninsured, while we might have some money for counseling and we might have some money for doctor visits, they're still having to struggle to get the medication that they need to pay for it. And they're still having to struggle as well to get through the day. And so transportation to these office visits, housing, and we deal with this every day. And so any treatment plan that you create, this little bit of money that we have, you have to make sure that you're spending it wisely. And so I would like you to think about that. There are no wait lists for cancer treatment in this country, but we have long wait lists for treatment facilities. And I'd never found, I'm a survivor of cancer, never found anybody that had to scrape up money for the day to get chemo. And so the urgency with 72,000 people dying last year, and the urgency, I think we need to have a focus on treatment. But like Barbara said, treatment is a sliver of that model. So next to that integrated care model that we're looking at, there is a public health model that you're aware of. In Project Lazarus, 35 different states. It's a community health model that includes prevention and education. It includes getting earlier and earlier detection for the disease in a primary care setting with earlier referrals so you get better treatment outcomes. Harm reduction is also a very important part of securing that, which Michelle will talk about. But the STOP Act as well, appropriate pain management so we're not making the situation worse. And so I would like to just, again, thank you for coming today. Thank you for your work. Thank you for fighting for North Carolina, and I appreciate this opportunity.
Thank you, Corey. And one of the things Corey mentioned is last week, the CDC released data and rating of states, and it shows in terms of projected opioid-related deaths, overdose deaths for 2018, the country will see a 6.6% increase in the number of people dying. Unfortunately, North Carolina made the list as number 2 in the country, and we were behind only Nebraska. Nebraska is projected to go from just a little bit over 100 overdoses in 2017 to 152 overdoses in 2018. So they had the largest percentage gain. North Carolina at 22% is number 2 in the country, and we're talking moving from 2,000 overdose deaths to 2,500 overdose deaths this year. So it really is an epidemic. You could fill up Panther Stadium and think about everyone in Panther Stadium dying, and that's about how many people died last year from opioid-related overdoses. The other thing I hear quite frequently is how much of our jails are filled up with people in active addiction. And some of the numbers I've heard, 80% or 85% of inmates have a substance use disorder, with opioid use disorder being one of the most common. I'm very excited. We've got 2 perspectives here today about the jail, but I'd like to go ahead and start with Major Reed Bear from the Deputy Chief of the Hickory Police Department. One of the things he's really led this community on is developing law enforcement assisted diversion. We had hoped to have the Hickory mayor here, Hank Guess. He was not able to cancel another long-standing appointment to show up, but when I explained that Major Bear was going to be here talking about it, he had every confidence that you would do as good or better job than he would.
Thank you. Thank you for having me. I appreciate you guys having me here today. You heard Governor Cooper earlier say you can't arrest your way out of this problem, and that's exactly right. I'm in my 22nd year of law enforcement, and so when we started looking at this issue, like many places around the country, we were seeing an increase in overdose calls for service from a police standpoint, particularly heroin, which got our attention. So we started to do some research, and we started to really look at the problem that was causing this number to increase. This is not an old problem in that in my 22 years, we've seen a cycle. In the late 90s, we were still at the tail end of a crack cocaine epidemic, which was causing the high violence in our community. Then that moved towards methamphetamine, which still continues to stick with us today with regards to property crime and violence in our community. And then you overlay that now with this opioid epidemic, and that also brings this whole another array of problems of severe addiction and overdose deaths in our community. So we looked at these numbers and trying to take the approach, realizing that every time you arrest someone who is in that spiral of addiction and you're putting them in jail, as Barbara just said, there's not a lot of treatment services in jail. So we started to look at what can we do as an agency on the front end to try to combat this issue instead of just responding to a call, doing a report, and moving on. And so we started to look around the country for different alternatives, and there's a lot of what is considered diversion programs out there. LEAD is one of them. The Angel Project, I believe, is one out of Nashville, North Carolina, and several others throughout the country. And along at that same time, we found a report that said Hickory was number 5 in the country for opioid abusers. And so we really started looking at these numbers and try to figure out what was going on. And although we couldn't find, we actually used some of the Department of Health and Human Services reports for injury and death related to opioids. And although we couldn't find a lot of information to support that number 5, we decided to treat it as if we were number 1 in the country. That was the mindset we were going to take. And I think from the law enforcement perspective, what I will say is it takes a mindset change for law enforcement. If I have any other law enforcement in the room, you go from the war on drugs the last 20-some years where it's arrest, jail, jail. You think that's going to solve a problem. But if you've been in this business or this area a long time, you realize that's just not the case. And so we found LEAD, Law Enforcement Assisted Diversion, was a program that we felt really matched our issue here in the city of Hickory. And what I mean by that is LEAD addresses a myriad of opioid addiction issues, but it also can address any other kind of addiction issues. It's not just an opioid program. So for those individuals we come across in our community that are addicted to methamphetamine or some other drug, they are eligible for this kind of program as well. And kind of the Reader's Digest version of how it works is when an officer responds to a call for service and you have an individual who's committed a low-level offense, and this officer recognizes that this individual is committing these offenses due to an addiction to drugs, then this officer can have a conversation with this individual and offer this individual a path to treatment opposed to getting charged with, say, something, I'm going to use larceny as an example, a misdemeanor larceny. Instead of charging them traditionally on a ticket, taking them to the magistrate, possibly getting a bond and sending them to jail where they're more than likely not going to get any help, this officer can offer them this program. And if that individual is willing to go into the program and wants help, then that charge is put on hold. This individual is connected directly to services immediately. And the research shows that those individuals who are connected to these services are much less likely to be involved in the criminal justice system. So when we started looking at this program, we felt like it fit us pretty well. And we reached out to partners in our community, Partners Behavioral Health, Catawba Valley Behavioral Health. We were very fortunate to get a lot of law enforcement agencies in our county, Newton Police, Conover Police, Claremont Police, and the Maiden Police Department on board as well. So we actually have a very unique program in that we have 5 law enforcement agencies. We have the service providers who really truthfully do the heavy lifting. Because once those officers can identify these individuals, whether it be a charge diversion or even what we call a social referral. So an officer who knows someone in the community who is struggling with addiction, they don't have to go commit a crime. These officers can go make contact with this individual, tell them about the program, and connect them to services immediately. Now, there are criteria. Obviously, we connect these individuals to case managers, so we have to ensure there's safety involved, and we have to ensure that certain convictions are not present. But once those individuals are identified, they're offered the services. And right now, we started in May, and right now we have 14 participants, I'm happy to say. And we are showing also, I'll mention this, we just ran our overdose numbers for the city of Hickory only. And right now we are showing, for whatever reason, I'm not sure yet, but we're showing a significant decrease from this time last year. And what we were seeing in our city limits was mostly heroin and fentanyl overdoses. That number this time last year was about 28, and currently we're sitting at about 14. So I don't know the explanation for that. We're going to be diving into that a little more, but that is encouraging. Combination of education, programs like LEAD, partners like the ones that sit at the table with us at LEAD, I think has made an impact on our community.
Thank you very much. I suspect that one of the things that has helped curb the overdose rates is the harm reduction approach. And we certainly have had some great legislation in the state to move clean needles, fentanyl test strips, as well as educating community members. Call 911. Don't abandon your buddy when things go bad. Get them the help that they need, that overdoses are reversible. Partners has worked hard to get naloxone out into the community. We're working now also on a project to do a layperson training on naloxone for family members and for others. We've done a lot of training with law enforcement and community first responders. We've trained our providers to give out these overdose reversal kits to high-risk consumers, but now we want to heed the most recent Surgeon General advisory to really get naloxone out to more and more hands so that any individual who may be exposed to somebody with an overdose has access and knows how to use that, knows what the signs and symptoms are. One of the trainer that we employed to work with our providers and law enforcement on naloxone and how to identify and reverse an overdose is Reverend Michelle Mathis. And she is the executive director and co-founder of Olive Branch Ministry, based right here in Hickory, although currently serving at least 6 other counties. And so, Michelle, tell us a little bit about what your agency does.
First, let me say thank you very much, Governor, for being here today and for listening with an open heart to the voices of the people here in Catawba County. I apologize. I will try to project. I woke up this morning with no voice, so I'm going to do my best. Olive Branch Ministry is faith-based harm reduction ministry located here in Hickory, but we do serve 6 additional counties. We are proud to have partnered with partners to open the Opioid Overdose Response Team in Gaston County, where we meet individuals at the time of overdose in the emergency room, or they're referred to us by EMS. And we partner them with a peer support specialist, which you've heard mentioned here. And we are a bridge to care. We make sure they get enrolled in harm reduction services if they need that, be it clean needle exchange, making sure they have naloxone and they know how to use it, making sure they have access to fentanyl test strips. Right now, 100% of what we're testing in this area is coming up positive for fentanyl, 100% of the heroin. So we think it's important for people to make informed decisions about what they're putting into their body. So we're proud to be able to do that. As a harm reduction specialist, I always look at with amazement in how minds and hearts have changed over the last several years. There was a point in time where we wouldn't be invited to this conversation. So I think we're making great progress to be included in treatment, which I think is great. I hope the majority of the folks in this room recognize that recovery is a continuum. So from my perspective, one small step can constitute recovery for an individual. So we see that if someone is willing to use clean needles as opposed to using dirty ones, if they have access to them, that's a step towards recovery. If we can get people to go into treatment before they commit crimes, trying to pay for whether it's their drugs or housing or food for their children, then that's a step towards recovery. And we're happy to be able to do that. One of the things that keeps people coming back to syringe exchanges is very, very much so the syringes, the access to clean needles, because they don't want to get HIV or Hep C. We offer HIV and Hep C testing. One of the things that we don't have access to are funds for those syringes because of the federal ban on syringes. And it's up to local municipalities at this point in the state of North Carolina to release funding if we're going to use public money to be able to keep our syringe exchange open. Something I would like to see happen is that harm reduction and harm reduction efforts, which are evidence-based programming, become part of policy in all treatment policies that are written, so that it's a natural part of the treatment plan, so we can keep people perhaps from being arrested, that we can get people into treatment sooner, that we can prevent the spread of communicable diseases by giving harm reduction the same kind of credibility that other agencies have, and recognizing that recovery can start at the harm reduction table. We serve individuals in these 7 counties. Last year, we gave out almost 100,000 clean syringes. and took back quite a few. We don't just put them out there. And those are individuals that we build relationships with. And when I hear about the deaths that have occurred and I see that, I don't see them in numbers. I see them in names and faces, because those are people that I know, that I deal with on a daily basis. So I want to thank you for being open to the idea of harm reduction. I want to thank you for your support thus far for that. I would like to challenge you to help make sure that harm reduction is part of future policies that are written, so that we can also obtain funding to be able to run our programs to make the burden less on the individuals that are having to do more extensive recovery. Thank you.
Thank you very much, Michelle. Harm reduction works. It's a public health approach that has done remarkable things in this country. If we look at the decrease that we've seen in automobile accidents, that's from harm reduction. Buckle up, wear your seatbelt. The decrease we've seen in drunk driving accidents, that also, you're going to go out, you're going to drink, get a designated driver. That's a harm reduction technique. It's not so different to have harm reduction, and I'm glad that Reverend Mathis works in our area and is so dedicated to getting out there to individuals and reaching out to them with the message that recovery is possible, treatment's available, that they still have dignity and respect. These are people. These are our brothers and sisters and aunts and uncles. These are members of our community, and she'll go out to wherever it takes to meet with them and to provide what she can to meet them where they're at. And one of the reasons we've been excited to fund these overdose response teams they're new, but they're showing some great success with people that engage immediately with that overdose responder. 23% or more will engage in treatment within 6 months. And that's just starting with the harm reduction, helping them understand better what they're taking, the risks they're running, and how to do it safely. But having that relationship gives them the hope and the dignity. And one of the last person I want to introduce today is one of those success stories. And I didn't realize it when we set this up, but he mentioned that he knew Michelle from years and years ago, and that she was one of those people that spent a lot of time talking to him. He is a Charlottean, but he moved out here to Hickory to begin his recovery journey. He works for Catawba Valley Behavioral Health, which is the provider agency that is doing the LEAD program. So without further ado, Duanes.
My name is Duanes Hopkins, and my voice also is, I've been talking all day. But first of all, I'd like to say I'm grateful to be here and nervous. Thank you, sir, for having me, all of you all for having me. And just briefly, I've been to jail over 30 or 40 times. I've been to prison 3.5 years. I sold drugs for 10 years. I used drugs for 20 years. So 30 years of my life in active addiction in some form or another. And 2014, January, I had enough. But I had been to so many rehab facilities that wouldn't nobody take me. They told me to go to the shelter in Charlotte and just let me go up there. And I told a lady at Detox, I said, please don't let me go die. I know it's something good in me. Please don't let me go die. And she said, well, let me call one more place. And she called Exodus up here in Hickory. Thank God for Exodus. I got to Exodus. They allowed me to come in. They didn't ask me for nothing. The only thing they asked me was to have the willingness to stay clean and sober one day at a time. And I went in that facility and I got busy about doing this. I don't know if you know how it feels to be homeless and running and the drugs is pushing you and you got to have it and you'll do anything to get it. 20 years I lived like that, 110 pounds, running around in Charlotte, dirty, stank. I'm just keeping it real. When I got to Detox, I had ran so hard that they had to cut my shoes off my feet. And I'm so grateful when I say I'm grateful to be here, that when I got to Exodus, the Exodus afforded me a chance to find a new way of life, whether it was the faith-based part of it, which I got in touch with the God of my understanding, NA, AA, whatever was there available, I took advantage of it. And today I'm a certified peer support specialist. I live independently. I work. I'm a tax-paying citizen now. And I couldn't have done that without this place being in this Exodus being there for me to be able to come to. And I thank God for Catawba Valley Behavioral Health, because once I got certified, they hired me. I wasn't a week out there, and I was working, 3 weeks really, because I never worked a 3-week notice on a job. And I worked 3 weeks, and I was working at Crowler Furniture for 2.5 years. And then I got hired as a certified peer support specialist, which I've been doing this almost 2.5 years, and 4.5 years clean now. It's awesome. And you know, what's so rewarding, man, is this lady saw me when I first got here, tore up, ripped up, and the things that she did and the things she represent was so awesome, and always encouraging. But what I want to say is I now work a peer support specialist jail services. I work inside Catawba and Lincoln County Jail. And what I do, I teach an 8-week drug class in each jail. And in the class, you find people coming in that's ripped up like I was and torn up, and they just looking for a ray of hope. And just for me to be able to, some of them come in hard, and, you know, I got to have this jail projection, and I got to be this and got to be that. But when I share my story, and I let them know, look, man, I've been here. I know what it's like. But you got to do something different. So I've become like a bridge, and I just want people to have a different life when they come out of jail. So in teaching the 8-week drug class, we teach up to the 4th step. And I introduce them to of how to deal with the feelings and what to deal with inside of you, because pain shared is pain lessened. And until you actually deal with the core of what's going on with you, you know, I let them know you're not a bad person trying to be good. You're a sick person trying to get well. And as I teach them in this drug class, or introduce them to NA and AA and Cognitive Connection or whatever resources we have, we also do one-on-ones. And it's just awesome. And now I called up a few rehab facilities. Dove's Nest is one. It's a $10 million facility that allows me to bring women straight from jail with no cost, no insurance. And I think it takes a heart of a person. It takes a heart of a person that wants to see somebody do good. Because when you look at somebody that, like me, that I committed crimes, I relapsed over and over and over again. If you all would have gave up on me, I wouldn't be sitting here today. So I'm just saying, the only thing that I'm bringing to the table is, if there's a chance for a person, my mother told me, she said, I watched you 20 years before you got back. And now when I pick up, she just look at me. She won't say that. I'm like, can you talk, woman? But with that said right there, what I like to see is just an opportunity for the jail to stay open and for Catawba Valley Behavioral Health to stay strong, because they employed somebody that's got a bad record. You know, they employed somebody that's been on drugs, and they gave me a chance, and I'm giving it everything I got. Thank you for letting me share.
And these are some of the programs that we need to have a peer in the jail, talking to people, doing education groups, really has that impact of helping people believe that they are worthy of recovery, that they're not lost, that there is hope and there is help for them. That's one of the things that it's very hard to fund. We can't use any Medicaid dollars for services in the jail. We can't use state dollars. And so it's county funds, and it's working with jail administrations to identify, is this worth it? while you have a jail full of people struggling, going through withdrawal, cycling in and out with opioid use disorder. One of things I want to circle back to, Corey, is talking. This is a horrible disease, but it is a disease, not unlike other diseases. So you're not a bad person when you have diabetes or heart disease or opioid use disorder. You have a disease that needs treatment. And one of the treatments that we are able to fund, and we have done a great job under the Cures funding and under Medicaid of expanding access to what I prefer to call medication-assisted recovery, because the medicines is just a small part of it. So Corey is the CEO and clinical director of Integrated Care of Greater Hickory, and that is truly that whole person health model, specifically for people struggling with addiction. So do you want to talk a little bit about what your company?
Thank you. Well, absolutely, we're recovery-based. I myself am in 20 years of recovery. I got clean on July 14th, 1998, in a program associated that was just like this one. And so, like the bridging over, when we didn't have peers, we had sponsors. And so, but what we're trying to do now is formalize that so that when treatment ends, recovery can continue. The thing that we didn't have back then was the medication-assisted treatment so that we wouldn't be sick. That's what's really anchoring people into this program. So an agency like mine has had to create its own pharmacy to provide for the uninsured low-cost or under-cost medication-assisted treatment to keep people in recovery. We also provide a toxicology service so they will guide our care, even though the state doesn't pay for toxicology services. Every one of our counselors is recovery-oriented, and most of our counselors are in long-term recovery themselves. And so we apply a 12-step facilitation model because that, for us, is the best evidence-based model that is really recovery-oriented. So everything that we do allows for this seamless transition into the self-help community of AA, NA, Celebrate Recovery, etc. And I think it's lost a lot of times. We have criminalized this disease, but we never criminalized diabetes. You know, it is a brain disease where the drugs literally hijack your brain. It takes over, you know, a lot of the cognitive functioning, the executive functioning of your brain. So you're not making the right decisions, Governor. And never have I seen a disease that's so powerful, except for maybe schizophrenia, where a mother will walk away from her own children to go use. You know, this is the kind of brain disease that when we wake up in recovery, like the ones that said, I look back on my life and I say, that really happened. All that negative stuff happened. How could I have done that? Because we're not in control of our lives. The compulsion to use, the obsessional thinking, it all gets down into the limbic center, the midbrain, and so we're not able to make those decisions. So medication-assisted treatment, you know, intensive counseling, comprehensive counseling, peer support services can guide these people while they're trying to get their brain functioning back to normal. And that's how I guess an integrated model would work best. Like the model that I gave you, is that they need housing, they need transportation, they need money for the medication. You know, they need educational opportunities because that's a big part of moving forward and employment opportunities. And so, but the thing that's lost is so many of us still look at it as a moral failing. HIV disease in this country, although there may be, I think, approximately under 7,000 deaths a year, $26 billion of funding, federal funding for HIV every year. And now you know that only $3 billion and tens of thousands every year are dying from this disease. And the Major's right. There's a substitution phenomenon. If we can't find the heroin today, we're going to find the meth today. We're going to get it out. But you know, I've never seen this before, where people's priority drugs were no longer oxycodone. They're no longer heroin. People are coming in. They're saying, my drug of choice is fentanyl. I need to chew on fentanyl patches all day long. So while we've done a lot, there's so much more to do, but I don't think that we can do it with the slim amount of money. So that the money that we do have should be spent wisely in this regard. Thank you.
Thank you, Corey. Governor, I recognize we're winding down. I'll give you the privilege of final comments.
I think one of the biggest challenges that we face, and I think we've heard it here today, is the stigma associated with this disease. When someone has a heart attack or cancer, everybody's over with the casserole, visiting, coming to help. when people have substance use disorder, often everybody scatters but family, and sometimes even they are turned away. So I think also with this disease, people meet it in different places and they respond differently to various treatments. I think medication-assisted treatment is one of the things that we know is evidence-based and works. I do believe that faith plays a role in this, and we should encourage faith-based efforts that are occurring. We know that it's going to take more of a concentrated effort in order to succeed. And when you think about the wide variety of issues that this disease affects, not only deaths, not only financial ruin with families, not only crimes against other people in the community, Major, not only our workforce, which is hurting because of this, but just in general, the health of our state. My CEO mission statement for North Carolina is that we're a state where people are better educated, where they're healthier, where they have more money in their pockets, and they have the opportunities to live a more abundant and purposeful life. That is my CEO mission statement. And when we talk about treating substance use disorder, that contributes to a healthier person with more money in their pockets. And so, we want to make sure that we are helping to coordinate this effort because there are a lot of moving parts. We're working to have opportunities like this and with the media in the background to help reduce the stigma and realize that there are success stories every single day of people who are making it and now contributing, taxpaying members of society. We have some tough times ahead because we know that the fentanyl that continues to come in, particularly the synthetic fentanyl, that it's just so strong that it kills people. We got to keep fighting the drug trafficking, but we know the only way we're really going to succeed in the long run is with treatment and prevention. So we want to be a part of the cure. We want to continue to work with our law enforcement and our mental health providers, our community groups, our reentry efforts to make sure that we hit this thing head on. It's going to require nothing less. So I'm grateful for the opportunity to be here and to be a part of this and to hear what I've heard. I learn something new every day on this issue. And I'm grateful for the opportunity. I hope those of you in the audience will take some things that you've learned and back to your various local governments and various communities and work to help implement some of these ideas. And I appreciate it, Barbara.
Thank you very much.